So it's Prostate Cancer Awareness Month right now, and prostate cancer is the most common non-skin related cancer in men. So about 1 in 7 men will be diagnosed with that in their lifetime, making it very common and something that we do worry about and something that we screen for. And a lot of guys do ask me about prevention, and of course that is important. Unfortunately, there are not a ton of things that we know that can prevent prostate cancer. So when we think about the risk factors for prostate cancer, it's generally going to be more common in older men. It is a little bit more common in African American men. For that reason, we start the screening process a little bit earlier. There are some studies that do show that a less healthy diet and being overweight or having things that fall under a condition called metabolic syndrome, which is basically high cholesterol, high sugar, high blood pressure, and being overweight, that the rates of cancer in general are higher in those individuals. So I do tell people frequently to just try and be mindful of their diet and to exercise regularly. Really, the name of the game is more trying to catch it early. And part of that is doing prostate cancer screening. So we typically, in guys between the ages of about 50 and 75 or so, we'll do a once-a-year blood test called a PSA, and then do a prostate exam or a digital rectal exam. And that can be done by the primary care physician, or it can be done by a urologist like myself. And then, of course, once we do figure out that someone does have prostate cancer, it becomes an issue of different kinds of treatment options. People often will ask me, how are we going to treat this, even before they have a diagnosis? And I'm sort of like, okay, well, we'll cross that bridge when we get to it, because there is such a wide variety of different treatments available. Anything from just watching it with something called active surveillance, to surgery, which is removal of the entire prostate, to radiation, which can be given in multiple different ways. And then there are several more investigational types of treatment, including ultrasound therapy and laser ablation. But typically the more standard treatments are either you're going to do surveillance, surgery, or radiation. And then it becomes a conversation about what's the risks, the benefits of each one versus the other. As a urologist, we are involved in mostly surgical management of prostate cancer, especially when it's just localized inside of the prostate. And typically nowadays we do that using a robotic Da Vinci surgery, which is less invasive. So people will stay in the hospital shorter, they'll have less pain, and they'll get back to their normal daily activities a lot quicker. Some of the after effects of surgery are still somewhat similar, because there are important other structures around the prostate that can affect urination and erectile function, but people are recovering better and better, and with that minimally invasive approach, we have been able to treat prostate cancer very successfully, and we've been doing that here at Holy Cross for many, many years, so we have a lot of good experience with that.